Hello everyone, my name is Rebecca Harris and this is my presentation on West Nile virus awareness in North Carolina. So let me start with a brief introduction. I am Rebecca and I am a student attending Lenore Ryan University. I'm striving to earn my master's in public health degree. I chose to focus my project on West Nile virus, which is a very prominent zoonotic disease in the continental United States. This presentation is specifically geared for people of North Carolina, which is my home state. So let's answer the big question. What is West Nile virus? West Nile virus is a zoonotic single-stranded RNA virus. This basically means that the virus itself has an animal host and is composed of one strand of RNA as opposed to being a DNA-based virus. Birds mainly serve as the host for West Nile virus and mosquitoes serve as the carrier. Humans can get West Nile virus whenever they are bitten by an infected mosquito and the virus enters the human's bloodstream. Fun fact about West Nile virus is that it is a member of the Flaviviridae family and the Flavivirus genus. Other notable diseases in this category include yellow fever, Japanese encephalitis, tick-borne encephalitis, and St. Louis encephalitis. So, who is affected by West Nile virus? In a nutshell, anyone that lives in an area with high concentrations of mosquitoes. In the South, we are all too familiar with mosquitoes, especially during the summer. There have been cases of West Nile virus for 6 consecutive years in the eastern United States, which designates West Nile virus, unfortunately, as a seasonally endemic disease. This basically means that West Nile virus cases are seen every single year, which means North Carolinians are at risk every year. In most cases, West Nile virus is not lethal. Remarkably, most people experience little to no symptoms at all and no disruption to their lifestyle. In about 20 to 40% of cases, people may have a fever, headache, vomiting, diarrhea, and all the other symptoms listed on the slide. In very rare cases of West Nile virus, patients may develop one or more of the following syndromes. I have them listed on the slide. They may develop acute flaccid paralysis, West Nile encephalitis, and West Nile meningitis. Each of these are potentially lethal if the patient does not receive effective medical treatment in a timely fashion. So now that we know the basics of West Nile virus, let's discuss the impacts it has on our society, starting with economic impacts. West Nile virus has a major impact on our economy, or at least it has the potential to. It's difficult to estimate a precise cost of West Nile virus simply because cases vary each year, patients have different types of insurance, and hospitals have different rates that they charge for their services. If patients have no symptoms, naturally they do not have to worry about any added costs. Patients with mild symptoms would have to pay for any over-the-counter treatments that they would receive to help with their symptoms. The main costs, however, are going to be in serious cases with the following syndromes that I listed on the previous slide. These are the ranges and prices here. As you can see, it can vary very widely. And so that would be the estimate that a patient would have to pay to be treated for West Nile virus. Let's move on to environmental impacts. There is a direct link between West Nile virus and climate change, especially global warming, particularly through increased temperatures, precipitation rates, and wind patterns. As the earth warms, mosquitoes need fewer intervals in between feedings. They have more time and opportunity to breed since they like having warmer temperatures. And the virus itself has a higher transmissibility rate among birds. Global warming has also influenced birds to migrate sooner, which introduces the hosts of West Nile virus to new areas longer. Precipitation also has an impact on West Nile virus. Heavy rainfall increases standing water, which, as we all know, is an excellent breeding ground for mosquitoes. Conversely, drought can also increase cases of West Nile virus since both mosquitoes and birds are in closer proximity as they look for water sources. Wind patterns also contribute to the distribution of West Nile virus. Storms can blow both birds and mosquitoes into new areas that previously did not host the disease. All in all, as more animals and people are exposed to the virus, we can expect to see even more changes in our environment as people get sick and animals continue to transmit the disease. All right, let's move on to social impacts. West Nile virus cases have been discovered in clusters in certain neighborhoods. There was a research study, and these scientists theorized 3 reasons why these cases appeared close together. Demographic characteristics, such as living in a low-income neighborhood, having older housing, and the mismanagement of water and sewer systems lead more opportunities for people to be bitten by mosquitoes. Little to no access to health care prevented people from receiving the care that they would need for their symptoms, especially those rare cases that we discussed earlier in the presentation. And finally, if the city maintenance crews do not check and treat potential mosquito breeding grounds, the likelihood of infection will increase in the community. Health impacts. So prior to 2002, West Nile virus cases were not described accurately in clinical settings. In fact, we didn't know a lot about West Nile virus. In 2004, a few scientists decided to embark on a new research study, and they found out that West Nile virus is actually more serious than we originally thought. In medical settings, 30% of patients are hospitalized, which creates a need for more medical professionals such as doctors and nurses to help these patients. So just as there were economic, environmental, social, and health impacts, West Nile virus also has public health impacts. West Nile virus will need funding for treatments and the creation of an effective vaccine. Currently, there is no vaccine for West Nile virus. Public health officials will need to advocate not only for the vaccine and for effective treatments, but they will also need to advocate for climate change regulations. Since West Nile virus is linked to climate change. And finally, public health researchers will need to make sure that they understand the virus and use the findings from previous studies to be used in future cases. Alright, so now that we know about West Nile virus and all of the various impacts it has on our society, let's move forward to the application section. How can we apply what we've known or what we've learned so we can impact our daily life? Let's address some challenges first. So one of the first challenges surrounding West Nile virus is that the diagnosis is difficult, especially with most cases going unnoticed due to the lack of symptoms. And I've listed a couple of solutions here. Firstly, medical professionals need to be educated about the signs and symptoms of West Nile virus. The sooner that they can detect it, the sooner we can get treatment for people. You can also initiate blood tests. There are some countries over in Europe that have already begun this process to look for West Nile virus in patients' blood. Finally, the most important, in my opinion, would be to create a safe and effective vaccine to prevent West Nile virus. Our second challenge is more of an environmental challenge. As we've learned, West Nile virus is heavily influenced by environmental factors. So here are some things you can do to help prevent West Nile virus in your own yard. First and most important is to drain any standing water in your yard. That means if you have any puddles, lakes, anything like that where a mosquito could breed, you need to get rid of it. You can also stock ponds with fish. Fish love to eat mosquitoes, and that will help cut down on the population. You also need to clean clogged gutters and overgrown vegetation. These are also good habitats and hospitable areas for mosquitoes, so by eliminating these areas, you'll eliminate mosquitoes as well. Finally, you can also use environmentally safe pesticides to prevent yourself from getting bitten by a mosquito. So, how can you prevent West Nile virus? You can wear protective clothing when adventuring outdoors. That includes wearing long sleeve shirts and long pants. You can use environmentally safe pesticides. You can speak to your doctor if you have any symptoms. And you can prevent mosquitoes from breeding in your yard. All in all, the best way to protect you and your family from West Nile virus is to stay informed and stay vigilant. Happy adventuring, North Carolina. Good luck!